from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Welcome back into Good Morning Arkansas. Today we're talking with Dr. Amanda Ferrell, Medical Director for Baptist Health Breast Center, about the importance of mammograms. And even during a pandemic, it's still important to go and get a scheduled annual mammogram if you are at that right age or if you are in the category of someone who is considered high risk that needs to go get mammograms. Dr. Ferrell, thanks for taking some time out of your day to join us and talk about the importance of this issue. Remind everybody about mammograms and why early screening is so important for people to get ahead of it if anything is found during a mammogram.
Yeah, thanks for having me. So for average risk patients, we still recommend that they begin screening at age 40 because we know that breast cancers do the best when we have early detection. Our breast surgeons do better when the tumors are small, when we find them small on a mammogram, and the chemotherapy works best when tumors are small. So screening is very important.
Whenever you're looking at someone who's coming in and they might be a little hesitant because of the pandemic and just they tried to avoid hospitals for the past year, how are you assuring them that the environment is safe for someone to come in and take care of something that might be routine but life-saving at the same time, so it's best not to put it off any longer?
Right, because we all know cancer doesn't quarantine. It's still out there happening. So all our techs wear masks because it's a very up close and personal exam between the technologist and the patient. We're vaccinated, and I don't know of a facility in town that has had a problem with transmission from an employee to a patient. So it's very low risk, even though it doesn't seem like it would be because they're so close to the patients.
What about someone who, speaking of the pandemic, has gotten a COVID vaccine recently? We've had some news reports on this, and I know that continuing data and what we're learning from these vaccines is continuing to come out and show different things. What have we learned about getting a COVID vaccine and how that could affect what we see on a mammogram?
Yeah, so it depends on if the patient has had the Moderna or the Pfizer vaccine. We see some people coming in with lymph nodes that are kind of reacting to the vaccine. You know, that's really what we want. We want the immune system to see the vaccine, the spike protein, and to mount a response. So in about 8 to 16% of the patients who get the vaccine, we actually see lymph nodes on the side of the injection that look kind of plump. Before we realized it was a side effect of the vaccine, we would call people back, we would do extra imaging, and maybe even a biopsy. So now that we know that that's a problem, we are asking patients to wait and about 4 to 6 weeks after their last shot to schedule their mammogram. But if they're overdue and they've had their shot, we will still schedule them. We just write a note. That's the side she had her vaccine on. We'll still probably call her back and work it up because we're thorough and cautious people. But it's in all likelihood just from having had the vaccine. But we want to see an immune response. I think it's really great that we see that.
Tell me about ABIS and what it is and how it helps you all detect early any type of cancers that might be prevalent in somebody.
Yeah, so we all know mammograms aren't perfect. And they, on a mammogram, normal breast tissue is white and background fat is gray. Well, breast cancers are white and a bunch of other things are white on a mammogram too. So if you're completely full of dense breast tissue, it's going to be harder for a mammogram to see a cancer. Ultrasound doesn't have that problem. So ABIS is an automated whole breast ultrasound. So it's a really big ultrasound scan head, and we do a few sweeps through the breast. The computer reconstructs it in a couple of different planes, so it makes it easier for us to look at. And the cancers don't hide on an ultrasound the way they do on a mammogram. Unfortunately, there are some of the other cancers that we only see on a mammogram. So it's supplemental or additional screening for people with dense breast tissue. It's not a replacement for a mammogram.
Okay. And then finally, if someone is looking to get that annual mammogram scheduled, or if someone has never scheduled one but is now in that category or that group that needs to start this process, what's the best way to do that?
Yeah, so if you are a Baptist patient, we allow patients to schedule through MyChart. So if you're not having any problems, it's just time to come in, use MyChart, you can schedule your screening. Otherwise, if you need to call or you're not set up on MyChart, the phone number is 501-202-1922.
Wonderful. Dr. Ferrell, thanks for your time this morning, and thanks for all the information you shared with our viewers. We appreciate it, and we'll talk with you next time.
Thanks for having me.